Okay, so to start things off, first and foremost, what is a facelift procedure and who's your best candidate for that?
Well, a facelift is kind of the gold standard, the original procedure for facial rejuvenation or to improve the signs of facial aging. And it is a surgical procedure. It typically involves incisions in front of, around, and behind the ears, and occasionally right under the chin. Now these scars are very well hidden. You know, we kind of put them in little natural folds and creases, so they're not very noticeable once it's healed. The ideal candidate for a facelift is a patient who has skin that's not necessarily treatable with the more or the less invasive treatments such as fillers and Botox, such as loose skin around the jowling area, loose skin or fat under the chin, and hollowing under the cheekbone area.
Awesome. So, Dr. Waldrop, at what age is it appropriate to start considering maybe I'm a candidate for a facelift?
It's a good question. There's no set answer on that. It doesn't depend on your chronological age. It more depends on your skin quality and skin tone and your goals. So many younger patients aren't quite ready for a facelift, and they can benefit mostly from fillers, Botox or Juvederm, or good skin care.
Nice.
That's a key concept. So anyone who is a candidate for a facelift needs good skin care before and after the facelift to help maintain the result.
Nice.
As far as after that, are you too old for a facelift? Probably not. As long as you're healthy, you can still undergo this procedure.
Awesome. So what I'm getting from this is everyone needs skincare, everyone no matter how old you are, and you're never too old for a facelift. Love that.
There it is.
So how long does a facelift procedure usually take you, and what are the risks of this surgery?
The procedure usually lasts about 2 to 2.5 hours. The risks for a facelift are really low, but I guess the most common risks that can happen are you can have maybe a little separation in the incision, maybe you get a little wound there that will heal up. You could have maybe uneven skin tightening that is very rare and unacceptable. The worst possible complication is an injury to the facial nerve where you could have a droop on the face. Again, that is exceedingly rare, and I've never seen it. So,
well, that's good to know. Nice. So after a patient has a facelift, how long until they are able to go back to work, social functions, things like that?
Another good question. So I usually tell patients who are going to have a facelift that they should plan a week to stay home and just kind of relax and take it easy. Everybody heals differently. Some people get more swelling and bruising than others, but usually after about a week, the swelling and bruising is mostly resolved, and it would be okay to go back to most jobs and resume social functions.
Nice, that's good. So another pretty decent question, how long do these results typically last, and how many years is this going to shave off your patient?
Oh yeah. Again, that can vary from patient to patient, but in general, I think it's safe to say that a facelift will take 10 years off of your appearance.
Nice.
And then as far as how long it lasts, you remember, so it's kind of like setting the clock back. So we've set it back 10 years, but then you continue to age, so those effects will continue as normal. That's why it's important to maintain the facelift with good skin care and avoidance of too much sun.
Nice. So we're just going to age more gracefully with a facelift. Love it.
Exactly.
Well, Dr. Waldrop, it's always a pleasure. Thanks so much for informing us, enlightening us on this facelift procedure, and you check us out next time on our next Cosmetic Close-Up.